Well, I'm Dr. Greet Baestaens from Naples, Florida, here in Riga, Latvia, with Dr. Karavani. And Dr. Karavani, I know you more than 35 years, so we have a long life together.
That's right.
And you were the pioneer of Botox, I can say, and fillers. Actually, I can say you were the pioneer in a lot of things like laser, non-invasive procedures. What possessed you to change your philosophy?
Well, is questioning what we are doing. And that was my first question 30, 40 years ago when I looked at the plastic surgery as an intern when we were doing facelift and nose jobs, etc. At the time, where I said this cannot be rejuvenation at all. We must work softer and preserve the faces, and that's where we turned to new technologies. In 1987, we turned already to new technologies of injectables, fillers with fat at the time. Weren't fillers like hyaluronic acid, they didn't exist at the time. We went up to do threads at the time, catgut threads, I mean, it's way back. And then we were happy to start with Botox in 1991. We were nearly the first in Europe and the fourth in the world to do that. And we saw faces becoming more natural. And then, like 10, 20 years later, and in 2012 it culminated, and we saw these faces become unnatural. See, they got weird, and we're 20 years later, 20 years later. We didn't know what's happening. So with colleagues from the States that I called, and they told me, we don't inject them anymore, these actors, because they look weird and we can't put them on the screen. So we don't know exactly what to do, but not this anymore. And then when my daughter got acquainted and with her future husband, the father was a radiologist, they had a CT scan in the clinic. We looked very much at CT scans to see what's happening inside. And we were surprised to see that the muscle mass is getting away. We get an atrophy in muscle mass to half what it was. And because it doesn't pull on the bone anymore, the bone loses its volume. So here we are with loss of volume of the muscle, loss of tone of the muscle. So the muscle doesn't have the power to hold the structures anymore. And we try to understand where it comes from. So we went to look up and we understood that it's a nervous problem. The brain and the muscles, they do not communicate anymore. And this goes in a loop back and forth. And when this loop doesn't function, we lose the muscular tone. When we lose the muscular tone, the muscle loses volume, but the bone also loses volume. At a certain point, we lose the capacity also to relax after each contraction like a child. See, a child contracts, but when he stops crying, it's totally relaxed. We lose that capacity. We lose the power to lift the face, but not only lifting the face, because facelifting is only half the story. The contracted muscles pull us down, so we need to relax those muscles, and we need to activate the power of the muscular tone upwards. So that's what we understood quite early, that it's a muscular problem. Rejuvenation is the shape of the face. It's a muscular problem and a bone problem, and it's related to the nerves. But we didn't crack the code completely. So we went to dive in to see what's going on when we are aging. And throughout the literature, we find aging everywhere because the whole body ages. And we find a consistency in the cause, which is we have 40% less oxygen on the red blood cell. So we have less oxygen going around in the body. And we have a blood flow that is 2.6 times slower. So imagine a bus with oxygen. We fill only about 2/3 of the seats, even less. The rest is empty. And the bus, instead of coming every 5 minutes to the bus station, comes every 15 minutes, 3 times slower. And that affects the whole body.
So how can you improve that blood flow and the oxygen level? How would you do that?
Well, that was, again, a deep search into the literature and the studies that have been done in very famous labs. And we're talking about MIT, the Institute of Technology, Massachusetts, which is the leading one for research. But also other universities followed, like Stanford, like Louvain, like very famous places. And the thing starts with the red blood cell, which has a molecule called hemoglobin. So when we breathe oxygen, the problem is not that there is too little oxygen in the air. Okay? That's really not a problem. The problem is we can't catch the oxygen into our red blood cells. Because to catch them, we need iron atoms. There are 4 iron atoms on each hemoglobin molecule. These iron atoms, they switch between iron 3 plus and iron 2 plus. Now the iron 2 plus is 1 electron more than the iron 3 plus, and only the iron 2 plus can attach the oxygen molecule to the hemoglobin and start transporting it. So we need more electrons in the system, not more oxygen in the air. Okay, good.
That makes sense.
So once we filled this bus with oxygen, we need to get him rolling. That means he needs to go at the speed that he's used to go. That means the blood flow must go to its maximum speed to deliver oxygen everywhere. And this has also to do with charges of electrons. If we don't dive too deep into that, basically the red blood cells are charged with electrons, so they don't clump together and they don't obstruct the blood vessel, so they repulse each other. The blood vessel itself is negatively charged, so the red blood cells don't rub against the wall of the blood vessel, but they are pushed in the middle. All of a sudden we got a frictionless movement, a bit like the magnetic trains in China. So without friction the flow goes better. When they reach the smallest capillaries, the smallest one that can go to every cell, because the delivery is a very good delivery. Okay, it's a delivery system 1 grade above FedEx, DHL, and or UPS together. You see, they go through the tiniest blood vessels to the tiniest street. They open the tiniest doors and they deliver their stuff. But for that, they need to fold, and they fold electrically. And they go through the capillaries electrically without any friction. They deliver their oxygen and they go back. See? So people who tell me we're going to bring everything from outside through injections or through whatever, they fail to understand how the delivery process is. The capillaries are 4 micron thick. A needle is 300 microns, which is about 80 times the size of the capillary. Which means that you're going to deliver in a very small street with an oil tanker. It doesn't go, so doesn't make any sense. Now, the blood who's propulsing this whole thing is not a pump either, because the left and the right ventricle are the same size, and they have to deliver to 2 totally different cycles, a short one to the lungs and an extremely long one, thousands of times longer, to the rest of the body, and they have the same size. So basically, they're not only pumps. They just push the blood a little bit. The rest is done by other mechanisms. So these ventricles of the heart, they have a special shape. They have 7 walls. And these 7 walls, they contract, and when they contract, they create a vortex. And this swirling vortex charges the red blood cells. A long time ago, we thought that it doesn't charge. And you will see a lot of literature who tells you that it doesn't. But recently, we discovered that there is a magnetic and energetic add-on to the red blood cell, and it catches these electrons, and these electrons, they drive the uptake of oxygen and they drive the circulation. And now we understand how we get 40% more oxygen and at least 3 times more the speed in the cycle, and that's the basis of anti-aging or rejuvenation.
So what is the implication of aging and rejuvenation with that technique?
Well, now that we understand how this oxygen is propulsed, we started to understand the cycle of an organ as the heart, which is a central organ. What does it mean? It's connected with the whole body. It's connected with the 40 trillion cells that we have. There aren't many organs who are connected to the whole body. Besides the heart, there is the brain with the nerves. They are also everywhere. Everywhere we can feel something. And they are also a central organ, the brain. And the third one that does also the full cycle in the whole body are the lymphatic vessels, the lymphatics. We have about 8 liters of lymphatics. They run into vessels and they drain the toxins and the waste products. And they go through like stations that we call lymph nodes where they are cleaned, and then the lymph goes back. But this runs through the whole body, and the intestines are very major organs in this lymphatic circuit. So we got 3 organs: the heart, the brain, and the intestines. All 3 have an electrical impulse. They are generating electricity. We can measure an electrocardiogram, we can measure an electroencephalogram, but we can also measure an electrogastrogram. Okay, so all 3 run on electrical cables because nerves are electrical cables. The cells are electrical, and the Schwann cells around it would speed up the signal are also living cells, and they all need oxygen. So with oxygen, we have a better nervous system. The electricity runs through the whole body. The lymphatics are also activated by the nerves. They empty and they clean the lymph nodes. So here we are, 3 systems that generate electricity, run through electricity, go through the whole body, and renew everything and clean everything and feed everything so that everything runs smoothly. And when everything runs smoothly, we happen to be young and nice and beautiful, just like adolescents and babies. They don't go to anti-aging doctors or beauty doctors. They have it from their own. Now, when we start eating unhealthy with a poor diet, we lose electrolytes through transpiration, urine, and others, and we compensate it only with table salt, which is 2 electrolytes instead of 90 and so forth. And bad food that we eat, etc., that we see all these loops degenerate, and when all these loops degenerate, we cannot repair our body and we start aging. So anti-aging is essentially the repair of these loops.
So, Dr. Karavani, you didn't answer my question really yet. So, what implications does it really have on our skin?
Almost everything. We understand now that all our cells are fed by 3 loops that keeps them alive. So we got everywhere in our body, we got bunches of living cells, whether it is our skin, our muscles, our bladder, etc., and they are fed by these loops. So when our fibroblasts, for instance, when they get blood flow full of oxygen, when they get nerve cells that give them the impact and the information, when they are drained from all their toxins, they work better, and we start by rejuvenating the fibroblast. And when those fibroblasts and all the cells are rejuvenated, we don't have to stimulate the fibroblast to produce more with needling, for instance, or with injections. Why? Young people don't need stimulation for a young fibroblast. So if your factory is brand new and oiled and everything functions well, you don't have to boost it to produce more. It's only an old fibroblast that we try to boost, but this is not the solution. You don't boost an old factory, you renew the processes and the techniques. So that's why we switched to a renewal of the fibroblast, make the fibroblast younger, so its offspring will be great, okay? And don't start stimulating it, okay? That's not the point. Now, we know also that the cells in the skin communicate electrically. We knew that they communicated, and there are also a bunch of articles about the communication between the cells, and that keeps the skin healthy. But what we know by now is that it goes far more than what we think. We know that the brain neurons, they work together. Not only they communicate, but they work together. Because if we can do complex things like move our hands or talk or get some ideas in our head, it's because billions of neurons work together to accomplish that, like a symphonic orchestra. So now we understand that the cells of the skin, they work together to form this organ as a whole. That's why we started to look at a more holistic way to treat the face, and we incorporate always the neck with that because they talk to each other. Whatever you do on the neck will have an impact on your eyes. So, but it goes much further than that. We have under the skin, under the hypodermis, we have a network. We call it a fascia. It's a network of specialized collagen fibers produced by myofibroblasts, which are different fibroblasts. And they are electric and conductive, but they are semiconductive. So they go from the toes to the head, that's the direction. Okay, and they are electrically charged. And all this fascia goes in connection with the deeper fascia, with the muscles, with the organs. In fact, there is a fascia everywhere around every cell, even organelles, and they are all electrically connected. I say always jokingly, nobody is naked inside the body. Everybody wears a jacket of fibroblasts, okay? And this jacket is an electrical jacket connected to everywhere in the body, okay? So we communicate. So all of a sudden we understood that what we are doing is actually wrong. We pay too much attention to the skin. Everybody's talking about the skin. But actually, if we look at the skin, we have the epidermis, which gives us the color. And it's about 0.1 millimeter in thickness. Regular paint is 0.3 millimeter. Paint on your car is more. So it's less than a layer of paint. So then we got the dermis, a millimeter. Can hold barely nothing. If you look at your eyelids, I mean, nothing, okay? Skin is nothing. Under that you have the hypodermis, which is a layer of nice living cells, fat cells, stem cells. And underneath that you have the fascia, okay? So what is important now is to get a good tight skin and a smooth skin. And studies have shown that it's the fascia who is doing that. The fascia has much more power to do that than the epidermis. We have a tissue where the stability is underneath, not on top. And it's working electrically. Even the regeneration of the cells to create stem cells is electrical. Even the regeneration of all the tissues through exosomes. We produce our own exosomes, we produce our own stem cells, we produce our own peptides to do the whole job. So there is no sense of injecting it with a needle that is 80 times the size of our organelles and organs in the skin. It's a huge aggression, okay? So no need to bring it from the outside, from someone else, not even from our own. We produce it fresh every day to our tissues. We just need to give them the means to do that, and that goes through oxygen.
Great. So what other health issues can we treat?
Well, every organ we can reach and regenerate oxygen uptake there through electrons will regenerate. So we are at the start, at the dawn of electromolecular medicine, which will be focused more on electrons than on biochemical products. We know that the bioelectricity runs our body. We know that bioelectricity runs our DNA, that it's not so much epigenetics like we thought, that it's an electrical software which programs what the DNA will do, and that it's also transmissible over generations. This is the work of Professor Michael Levin, okay, who show that time and again, that the electrical impulses are the software on which the body runs. So what we are looking at and what we are doing in aesthetic clinics is working on the hardware while the body is run by software. And this is a paradigm shift. See? So, organs that we can reach and that bother a lot of people are, of course, skin. And we should not start burning the skin with infrared lasers. or with plasma, or with radiofrequency, with or without needling, because we kill all those elements that we need to rejuvenate. Of course, we are tighter for a while, but that is not rejuvenation. Rejuvenation is that we are really younger, not contracted and dead. We kill stem cells, we kill our exosomes, we kill our peptides, we kill our fibroblasts, we kill our myofibroblasts. We treat the fascia badly, okay? And all this in the name of tight skin and temporary contraction. And we measure our successes on a short run, like before and afters, over a month or over a few days, or even after a year. While the time span that we want to cover in anti-aging runs from 35 years over 85 years. So we got 50 years where we need to benefit from anti-aging and rejuvenation, and we take a small segment out of that from 35 till 50, and we show how tight and beautiful people are, but it's in fact the pact with the devil, because from the age of 55, 60, you start getting bills of whatever you did in the past, and the bills accumulate, and you run out of your credit card. The credit line is overdue, and all of a sudden they repossess your house exactly at the moment where you wanted to find some rest. You're 65, you have time, the children are big, you're retired, you get more money, you get more finances, you get more friends, and you want to enjoy life, and you pay your mistakes of the past when you were 35 till 50 because you wanted to look 30. So 50 might be the new 30, but 65 will be the new 85. And that's the risk that we are taking. So that's about the skin.
Yes.
But we got a lot more organs than that.
So we talked about the skin that we can rejuvenate with this technique. So wouldn't that be enough? That is important for us because that's what we see.
That's where everybody is focused on a beautiful skin and skin rejuvenation, and every clinic advertises with the skin and the skin and the skin. But in fact, it's not the skin at all. It's the facial shape. Look at the baby. A baby can frown, can have a lot of spots from birth, can have acne, neonatal acne exists, can even have scars or other things, but it's still a baby. While we know people who are much older, the facial shape is different and they have a flawless skin. I always bring Donatella Versace as an example. Flawless skin, but the facial shape is not okay. Recently, she heard my talks. Telepathy exists, and she changed that, her facial shape. And you see everybody's talking about it. Oh, she rejuvenated because the facial shape changed, okay? And why does the facial shape change? Because everything inside, underneath that tiny little layer that is the skin, is changing. And that change happens only much later. Ligaments that hold the skin up and hold the face up. The fascia, which goes deeper and holds the skin up with a deep fascia. The muscles who have muscular tone and lift the skin and at the same time relax so that it's not pulled downwards. The bone that is worked on, that is not lost. That is real rejuvenation. That is real youth. And we cannot achieve that with lasers. We cannot achieve that with a better skin. We tried to correct these volumes, these dynamic volumes of muscle and bone. We tried to correct it with hyaluronic acid fillers or with other fillers. Well, we see that they create inflammation. They're totally not dynamic. They don't move with us. They migrate. They attract water, okay? So we start bloating. And they don't preserve our bone. So we're there with a face that when it's injected, it looks good, but it changes rapidly over the coming months and years. And we have seen them. It bears a name, the pillow face. And we saw Tom Cruise, we saw Madonna, we saw Meg Ryan at the time. All these faces, they start to change. And we don't want that. So we work on the deep structures of the face to prevent this abnormal face or this aged face that doesn't reflect the age that you have. So the skin is not enough. It's barely a reflection of what's happening inside.
So we talked about the skin, we talked about the underlying structure. So what about hair?
Well, hair is a very interesting organ because it's a tiny pouch, the hair follicle. And this hair follicle loses its capacity to produce hair and its size over time. We call it miniaturization. It becomes a miniature of itself. Dormant or sleeping hair follicles is another description for that. So there is a distinct difference between men and women, like always, and like always, they are much more similar than they think they are. Okay? So let's start, for instance, with men, because their hair loss starts at a much younger age due to testosterone, etc. So at 15, somebody who is genetically predisposed because the father is bald or the brothers of the mother are bald will start losing hair, will have thinning hair. And when it goes to the exam periods at college, 18, 19, they will lose even more hair. So the idea is not to wait till they lost the capacity to produce hair and that they have very tiny miniature hair follicles. It's the prevention that counts, because once it's lost, it's a whole different ball game, and they need transplants, and I mean, you can't recuperate it that easily. And even transplants, it's not when you're totally bald, you can only do that a few times. After that, you run out of hair follicles. So at the age when it starts, and it can be 15, but it can be 25 too. I was bald at the age of 22, so for me everything was too late, so I couldn't do anything. But if I would have known that at that time, I would have had my hairs. Now my son, which is already the next generation, he has hair where I didn't have hair. He's 36, has his hair where I don't have it, okay? So we see already how this prevention with electromodular medicine changes the whole ball game. So we can't do anything else over these 60 years, between 15 years and 75 years. We can't inject them with PRP or whatever, or with exosome, whatever. We can't do that. By the way, we create that with electromolecular medicine. We can't give them minoxidil their whole life. After a while, it irritates and it doesn't work anymore. We can't give them DHT blockers like finasteride or dutasteride, because at the age of 15, 16, 20, they have a lot of hormones, male hormones, so that is okay. But at the age of 50, 60, we have to buy them back, okay? So you can't sustain that over the period of time. So as we said, success in anti-aging is when you finish the race, and the race is a marathon. For the moment, everything we see on social media is a sprint of 100 meters. That's not the race of anti-aging, okay? That's very easy to arrange. The real winners are those who go to the finish line in a marathon. Go. So we preserve their hair follicles. When everything goes well, they won't need anything. They won't need any transplants, anything. They will have healthy hair. Women can postpone this because their problem of androgenetic alopecia starts at perimenopause. So they will do at perimenopause what men do at puberty, okay? But they have other issues. They have hormonal disturbances at an early age. From women that have at puberty problems with polycystic ovarian, endometriosis, and all these kind of things, till women who give a normal childbirth but have their hair falling down because of hormonal effects. And these will be compensated by temporary sessions of electromodulation. And then we go at the age of 50 to preserve the youth of your hair, so you can keep longer hair at an older age. Okay? And that is the beauty of it. It's a long-term thing. The same counts for anti-aging of skin and face. It's a marathon. Okay? You have to run it slowly, but steadily, and hold on till the rest of your life. And you can do that only with a super healthy natural technique that targets the core problem and is 100% safe and natural and doesn't affect you and gives you a pleasant feeling while you're doing that.
Mm-hmm. So any other organs that we can treat?
Of course, because the whole body ages, but we can't reach every organ. If we would be able to reach every organ, we would go straight to the pancreas, we would go to the liver, we will go to the heart, we will go to other organs to rejuvenate them. But for the moment, there are serious things that we can do that would help people, and one of them is urinary incontinence. We can reach the loop between the spine and the bladder very easily, and within the first session or the second session, you already see the problem of incontinence resolve. And it's a major problem. It's a major problem for women. They have to look for a bathroom constantly. During the day, they can't even take a bus. And it's very annoying. There is no solution for that. And it's a major problem for men. A bit later, it comes a bit later, but it wakes them up at night. It gives them urinary urges. I mean, a blockage of the prostate where they can't urinate with the streak that they were used to do. So these are life changers, and they are so easy to arrange, much easier than hair, skin, or facial shape. So I would advise that for everybody who suffers from these things, there are enough gynecologists who can testify to that, how easy it is and how nice and quickly it works.
Anything about other injuries or?
Well,
since we talked about PRP and
yes,
exosomes.
Of course. Yeah. PRP has been invented because joints and articulations didn't have enough blood flow. Now it's exactly these areas where we can generate the PRP on site by degranulating the thrombocytes. And the thrombocytes, they react to electromodulation, which means that they will release their ingredients of growth factors, and they will be able to restore places with very little and poor blood flow, like articulations, cartilage, and tendons. So yes, for sports people, of course. And when we have sports injuries, it treats also the nervous problem, it treats the lymphatics for the swelling, it treats the blood flow in the region. So we have a lot of advantages in doing that. Most of these people are very young, these sports athletes, so it goes very quickly. But even at an older age, if you have articulatory problems and inflammation, you would benefit from that.
I have patients that come in with neuropathy, and is there a way that we can treat those patients?
Yes, of course, because you're not solely an aesthetic doctor, so you treat a larger scope, so you can benefit much more from electromolecular medicine than most people. So functional doctors, they can treat neuropathy, all kind of pain issues, because chronic pain is not a normal thing. Acute pain is a lifesaver, but chronic pain is a defect in transmission, so it resolves quite quickly. Constipation, vagal nerve reset, but one that goes from the brain till the lower pubic area, which is a very vast area. We treat the whole thing, not only this area here. By the way, when you do a full face from the neck to the toe, you get the mental relaxation of the prefrontal cortex, and you get the vagal nerve, the short part, equally arranged, okay? So, we talked about mental. You can get a mental relaxation, you can treat anxiety and depression, you can treat insomnia, clarity of the mind, and focus. We had psychiatrists who were equipped with electromodulation devices of ours, and which use that for the mental health of their patients. So you can do a lot, from mental health to neuropathy to vagal nerve to motor nerves on the spine, where you reset the whole spine, and you get there these contractions and back pains. So a lot of back pains are resolved by that. Okay, so definitely I'm a big advocate for functional medicine with electromodulation. It's a changer, it's a game changer for these doctors, and we have several of them.
So this sounds all amazing, but is this, you think, the new, you know, is it going to replace medicine, or is it something just we kind of...
Well, I know a lot of people thought it was a fling and it's temporarily or a hype, but the literature around it is growing by the day. When you know that we have a Nobel Prize about electricity and the body in 1963 by Huxley, okay, a Nobel Prize. If you see that major universities like MIT, like Stanford, like Louvain and others who talk already about the electrome, like the microbiome, okay, and who talk already about all the benefits that we can have. If we see people like Professor Michael Levin from Turf University, who is doing all these research on how we can reprogram the DNA of the body in order to reshape and cure worms and others, okay? How cancer resolves with that in animal models. We understand that we now have so much evidence about the resetting powers. We call it healing, but it's a resetting to our factory settings, to the healthy organs, that it is there to stay, to grow, and maybe even to replace everything we know by now. We know also that diseased cells, cancer cells, are running on minus 20 millivolts, while a healthy cell runs on minus 70 millivolts, which means much more charged in electrons. These electrons in the mitochondria convert to ATP. The ATP is the power of our body. So we're dealing with mitochondrial health, okay? When all this evidence comes out that acidity in our body, which we know correlated with a lot of diseases, is draining us from electrons, while a more basic alkaline environment, which has a lot more electrons, is getting us healthier and healthier, and disease cannot survive in an alkaline environment because of the load of electrons. And this has been there for thousands of years, because whenever people are acidic, and a lot of languages use the term acidic in a bad temper, okay? Or people who are disappointed of life, they get acidic. So we know that that brings them into a disease, and that's essentially because of a lack of electrons. So electricity is here to stay and grow.
So we can call it a natural revolution.
It is a revolution in our thinking. I think nature knew it all along, because if we look at the earth from above, we see it green and blue, where green is the electrons, green leaves, etc. They contain a lot of electrons and they are acidic. And then we see the sea with a lot of electrolytes to transport that. We need electrolytes to keep this electricity running. So nature kind of knew it all along, okay? But the revolution is essentially in our minds to look at the causes very thoroughly and discover that looking at it from a natural point of view, adding to that the technology and creating something that is what we would call the green tech, the green health, or health tech, whatever you call it. But we are humans that are natural, and if we can, I would say, biohack ourselves with natural means, aided by technology, electrons and software, yes, we might benefit from that big time.
Okay. Well, I'm looking forward to that
Me too.
future.
Me too. It concerns us more than the offspring, than
Right.
the little babies. They have 20 years ahead.
Yeah.
Good.
Yeah.
Thank you very
Thank
much,
you.
Dr. Baestaens.
Thank you,
And
Dr.
happy to
Karavani.
see you grow in the United States.
Thank you.
That maybe one day you'll reach our first lady or your first lady.
We hope so.
Yes, because she's such a natural beauty that she would benefit from
Absolutely.
natural technologies.
Yeah. I'm sure she will hear from this. Yeah.
Great.
Thank you.
Welcome.